differences between the plans?
Hearing Senator Rand Paul, there are many parts of that the same as our plan. Senator Cassidy and I have a plan. It's called the World's Greatest Health Care Plan. And in fact, it does many of the same things that Senator Paul talked about, but the processes are really, really important, and Senator Paul has it correctly. We must first replace Obamacare with a better plan. Republicans have better ideas, and much of it is through tax credits. It gives everybody in this country an opportunity to have the same tax advantage that everyone else does that works for a large company. We need to increase the number of people that are in our insurance pools. We need more people to want to pay in and have a lifetime insurance plan. But the World's Greatest Health Care Plan says at its very core that what we're going to do is to do away with the individual and the business mandate and the Cadillac tax. What we've got to do is take away the parts that harm our economy and that keep consumers from being consumers. And this is where Rand Paul's plan, the World's Greatest Health Care Plan, are very, very close and similar. But the key component here is we must be able to sell the American people on what's better and pass that before we repeal Obamacare.
And how do you do that? What do you mean? So it sounds like you're now trying to, you have to first convince the American people that this is better, and then you say that effort would be made to repeal and replace with this suggested plan?
Well, I think that there is essentially at this point 3 or 4 competing plans. One is what might be called a better way that is not yet a bill, and we really don't know how it works. Paul Ryan is attempting to push that. We have Senator Rand's plan. We have Pete Sessions and Bill Cassidy's plan, World's Greatest Health Care Plan, and we have Tom Price's plan. It's really going to come down to where members of Congress, House and Senate, need to look and focus their activities on these 4 bills and then be engaged in the national, dialogue, enabling America to understand why we need to change the rules of the game. I'm for making America health care better for everybody, not just a new system. Okay, and that's why I'm going to be for my plan.
So at the beginning of this conversation, it was starting to sound like you were presenting this in a very simplified manner, and the question would have been, you know, if it's so simple, then why hasn't this happened before? But now you're talking about a number of choices in which the Senate and Congress would have to come together to discern which is the best one. So how far away are we talking, and is it your view that it will be packaged in a much more appetizing way to the American public than what 30 million people are already enjoying? How do you offer those assurances?
Well, what I would say to you is there was a discussion that was coming out of Washington saying we would repeal it and then replace it within a couple years. That quickly became unacceptable to at least members of the House and the Senate, and that changed the dialogue from 2 weeks ago. Now we're on a dialogue that says let's have a messaging around one bill that we would pass, and then we will repeal Obamacare. These are all positive signs that Republicans, like Senator Rand Paul, arch conservative, will bring the best ideas to the table. I believe it will be somewhere between Senator Paul's and Senator Cassidy's my bill, the World's Greatest Health Care Plan. The best ideas reside within that world. It's just a matter of us going to sell these and the American people recognizing we have to give every single person in this country an opportunity to have better health care than they have today.
All right, still ahead, President-elect Donald Trump's press conference this week fell victim